Dr. Robert Chen had performed over 10,000 surgeries in his career, but none had ever required him to sterilize nail clippers with airplane vodka. Flight 447 was about to become the most unconventional operating room in aviation history, and failure wasn't an option. Welcome to Human Stories. Before we dive into this incredible tale of courage and medical heroism, let us know where you're watching from in the comments below. Are you from New York, London, Tokyo, or somewhere else in the world? We love hearing from our global community. And if you're new here, make sure to subscribe and hit that notification bell so you never miss stories of extraordinary people doing extraordinary things. The trouble began 3 hours into the transatlantic flight from New York to London. Dr. Chen had been enjoying his retirement, finally taking the European vacation his late wife Margaret had always dreamed of. At 68, after 4 decades as a trauma surgeon at Mount Sinai Hospital, he thought his days of emergency medicine were behind him. He was reading a novel when the overhead announcement crackled through the cabin. Ladies and gentlemen, we have a medical emergency on board. If there is a doctor or medical professional among the passengers, please press your call button immediately. Robert looked around the business class cabin. A few passengers were glancing nervously at each other, but no call buttons were lighting up. He hesitated for a moment, thinking about his retirement, about how he deliberately left medicine behind. But old habits and deeper instincts took over. He pressed his call button. Flight attendant Jessica Martinez rushed to his seat. "Are you a medical professional, sir?" "Retired trauma surgeon," Robert said, already unbuckling his seatbelt. "What's the situation?" Jessica's face showed relief mixed with worry. "It's a young girl, maybe 8 years old. She collapsed about 10 minutes ago. She's conscious but in severe pain, and her parents are terrified." As Robert followed Jessica toward the back of the plane, he could hear crying, both from a child and from what sounded like frantic parents. They found 8-year-old Emma Thompson curled up across 3 seats, her face pale and sweaty, clutching her lower right abdomen, while her mother Sarah held her hand, and her father James paced anxiously in the narrow aisle. Robert knelt beside the seats and immediately recognized the signs. The way Emma was positioned, the location of her pain, her facial expression. He'd seen it thousands of times before. "I'm Dr. Chen," he said gently to Emma. "Can you tell me where it hurts the most?" Emma pointed to her lower right side, tears streaming down her face. "It really hurts. And it's getting worse." Robert performed a quick examination, checking for rebound tenderness, testing for fever. Every sign pointed to the same diagnosis: acute appendicitis. And from Emma's symptoms, it was progressing rapidly. He pulled Sarah and James aside. "I believe your daughter has appendicitis. Her appendix is inflamed and needs to be removed surgically soon." Sarah's face went white. "But we're on a plane. We can't do surgery here." "How long until we land?" Robert asked Jessica. 4.5 hours to London," she replied. "We could divert to Reykjavik, but that would still be 3 hours." Robert looked back at Emma, who was now crying more intensely. 3 hours might be too long. If her appendix ruptured at 37,000 feet, she could die from sepsis before they reached any hospital. "I need to see your medical kit," Robert told Jessica. The airline medical kit was designed for basic emergencies: heart attacks, diabetic episodes, minor injuries. It contained a blood pressure cuff, basic medications, bandages, and a few other supplies. Nothing resembling surgical instruments. Robert stared at the contents, his mind racing. In a hospital, an appendectomy was routine surgery. But here, with no proper instruments, no anesthesia, no sterile environment, it seemed impossible. Then, he remembered his military medical training from Vietnam, where he'd learned to improvise with whatever was available. He'd once removed shrapnel using a mess hall spoon and saved a soldier's life with materials scavenged from a field kitchen. If you want to see how Dr. Chen turns an airplane cabin into an operating room using nothing but improvised tools and decades of experience, make sure you subscribe to Medical Hero Stories, because what he does next will challenge everything you think you know about emergency surgery. I need you to make an announcement, Robert told Jessica. Ask if anyone on board has nail clippers, dental floss, and any small sharp objects. Also, ask for any passengers who work in medical fields, nurses, veterinarians, anyone with surgical experience. Jessica looked at him incredulously. Sir, are you suggesting what I think you're suggesting? I'm suggesting that little girl will die if we don't act, Robert said firmly. And I've performed emergency surgery in worse conditions than this. The announcement went out, and within minutes, passengers began bringing supplies forward. A businessman donated his nail clippers. A dental hygienist from Seattle provided dental floss. A woman traveling with her sewing kit offered small, sharp scissors. Most importantly, a retired Army medic named Tom Bradley and a veterinary nurse named Lisa Park volunteered to assist. But Robert knew the biggest challenge wasn't the improvised instruments. It was creating a sterile environment and managing pain without proper anesthesia. We need the vodka from the bar cart, he told Jessica. All of it. And I need you to clear the galley area at the back of the plane. As the crew worked to prepare the space, Robert explained the situation to Emma's parents. This is extremely risky. I'm going to attempt to remove her appendix using improvised instruments. The alternative is that we hope her appendix doesn't rupture in the next 4 hours. James Thompson looked at his daughter, who was now barely conscious from pain. What would you do if this was your child? Robert thought about his own daughter, grown now with children of her own. I'd want the surgeon to try. The galley had been cleared and cleaned as much as possible. Robert used vodka to sterilize every surface and every improvised instrument. The nail clippers would serve as his primary cutting tool. Dental floss would be his sutures. The sewing scissors would help with precision work. Tom Bradley, the retired medic, helped position Emma while Lisa Park prepared the improvised surgical kit. They'd rigged up airplane reading lights to provide the best illumination possible. Emma, I need you to be very brave, Robert told the little girl. This is going to hurt, but I'm going to make you better. The most dangerous part wasn't the surgery itself. It was doing it without proper anesthesia. The medical kit contained some pain medication, but nothing approaching what would be needed for surgery. Robert made the decision to proceed with local anesthetic from the kit and rely on Emma's natural shock response to minimize pain. It wasn't ideal, but it was their only option. What happened next would be talked about in aviation medical journals for years to come. Using nail clippers sterilized with vodka, Robert made a small incision in Emma's lower abdomen. Working entirely by touch and experience, he located the inflamed appendix. The confined space made everything more difficult. Robert had to work at awkward angles, with Tom holding the improvised lights and Lisa assisting with instruments. Every movement had to be precise. There was no room for error at 37,000 feet. The appendix was more inflamed than he'd hoped, but hadn't ruptured yet. Using the nail clippers and sewing scissors, Robert carefully separated it from the surrounding tissue. The dental floss, sterilized and doubled for strength, served as both clamps and sutures. Emma, despite being only 8 years old, showed incredible bravery throughout the procedure. The combination of pain medication and shock kept her relatively still, while her parents held her hands and whispered encouragement. 28 minutes later, Robert held up the inflamed appendix, successfully removed using instruments that no medical school had ever taught him to use. Is it over? Emma whispered, her voice weak but alert. It's over, sweetheart, Robert said, carefully suturing the incision with dental floss. You're going to be fine. The cabin erupted in applause as word spread that the surgery had been successful. Passengers, who had been praying for the little girl's recovery, were crying with relief. But Robert knew the real test would come in the next few hours. Infection was still a risk, and Emma would need proper medical care as soon as they landed. Captain Williams made an announcement to the cabin. "Ladies and gentlemen, thanks to the extraordinary skill of Dr. Chen and the assistance of our volunteer medical team, our young passenger is stable and recovering. We've been in contact with London Emergency Services, and a full medical team will be waiting when we land." For the remaining 2 hours of the flight, Robert monitored Emma carefully. Her vital signs remained stable, and there were no signs of complications. The improvised surgery had worked. When Flight 447 touched down at Heathrow, paramedics immediately boarded and transferred Emma to a waiting ambulance. The hospital's chief of surgery later confirmed that Robert's work had been flawless. The appendix had been removed completely, with no damage to surrounding tissue. Dr. James Morrison, who reviewed the case at London's Royal Hospital, called it the most remarkable piece of emergency surgery he'd ever seen. To perform an appendectomy with improvised instruments in an airplane galley with no proper anesthesia, it should have been impossible. But Robert knew it wasn't impossible. It was simply medicine stripped down to its most essential elements: knowledge, experience, and the determination to save a life regardless of circumstances. The story made international headlines. Surgeon saves child's life. Using nail clippers at 37,000 feet, appeared in newspapers around the world. Medical schools began studying the case as an example of extreme emergency medicine. Emma Thompson made a full recovery and sent Robert a drawing she'd made of their airplane surgery. In her 8-year-old artistic style, she'd drawn Dr. Chen as a superhero with a stethoscope, surrounded by clouds, saving the day. 3 months later, Robert received a call from the International Association of Emergency Medicine. They wanted him to help develop new protocols for in-flight medical emergencies, recognizing that sometimes the most important surgery happens in the most impossible places. After what you did on Flight 447, the association's president told him, "We realized we need to completely rethink what's possible in emergency medicine." Robert returned to consulting work, not as a retired surgeon, but as a specialist in extreme emergency procedures. He began teaching courses on improvised surgery for military medics, disaster response teams, and airline medical personnel. But he never forgot the lesson of Flight 447, that sometimes the difference between life and death isn't about having perfect conditions or ideal equipment. Sometimes it's about having the knowledge and courage to act when action seems impossible. What would you have done in Dr. Chen's position? When faced with a child's life hanging in the balance and no proper surgical equipment, would you have attempted the surgery or waited for landing? Share your thoughts in the comments. Have you ever witnessed or experienced a medical emergency in an unexpected location? Tell us your story in the comments below. And if this story reminded you that medical heroes sometimes have to work in impossible conditions, make sure to subscribe for more real-life emergency medical stories that show the incredible dedication and skill of healthcare workers around the world. The next time you're on a flight and hear, "Is there a doctor on board?" remember Flight 447 and Dr. Robert Chen, who proved that sometimes the most important operating room is wherever life needs saving, performed by people who refuse to accept that circumstances can defeat medicine. Emma Thompson is now 12 years old and wants to become a doctor when she grows up. She says she wants to help people the way Dr. Chen helped her. Sometimes the most important lessons about medicine aren't taught in medical schools, but learned at 37,000 feet, where an impossible surgery becomes possible through knowledge, courage, and improvised nail clippers. Where are you watching from? Have you ever had to improvise in an emergency situation? Let us know in the comments. And remember to subscribe for more incredible stories of medical heroes who prove that saving lives isn't about perfect conditions. It's about perfect determination. In the weeks following the incident, Robert Chen found himself reflecting deeply on what had transpired aboard Flight 447. The experience had awakened something within him that retirement had temporarily put to sleep. The profound sense of purpose that comes from practicing medicine at its most fundamental level. He realized that his decision to retire had been premature, driven more by grief over Margaret's passing than by any genuine desire to leave the profession he loved. The media attention was overwhelming at first. News crews camped outside his Manhattan apartment, and his phone rang constantly with interview requests from around the globe. Medical journals wanted detailed accounts of the procedure. Television networks offered lucrative deals for exclusive interviews. But Robert remained humble throughout it all, insisting that he had simply done what any experienced surgeon would have done in similar circumstances. What fascinated medical professionals worldwide wasn't just that he had performed the surgery, but how he had approached the problem. In an era of increasingly specialized medicine, where surgeons often relied heavily on technology and standardized protocols, Robert had demonstrated the value of fundamental medical knowledge and clinical intuition. He had assessed the situation, made critical decisions under pressure, and executed a complex procedure with minimal resources, skills that some argued were being lost in modern medical training. The International Association of Emergency Medicine wasn't the only organization that reached out. NASA's medical team contacted him about consulting on emergency procedures for long-duration spaceflights, where astronauts might face medical crises millions of miles from Earth. Military special operations units wanted him to train their medics in extreme improvisation techniques. Even disaster relief organizations saw the relevance of his experience to their work in remote areas with limited medical infrastructure. Robert accepted selected opportunities, but he was careful not to let the fame change who he was. He remembered his roots as a young medical student, inspired by teachers who emphasized that medicine was fundamentally about the relationship between healer and patient, not about impressive equipment or comfortable surroundings. His daughter, Michelle, flew in from California to visit him after the story broke. She brought his grandchildren, who looked at their grandfather with newfound awe. "Grandpa, you're like a real superhero," his 7-year-old grandson told him, echoing Emma Thompson's sentiments. Michelle, herself a pediatric nurse, understood the magnitude of what her father had accomplished. They spent long evenings discussing the case, and she encouraged him to share his knowledge more widely. The Thompson family stayed in touch with Robert, and a deep friendship developed between the families. Sarah and James Thompson credited him not just with saving Emma's life, but with teaching them about courage and grace under pressure. They visited New York twice that first year, and Emma always brought new drawings of doctors and airplanes. One particular moment stood out in Robert's memory from those follow-up visits. Emma asked him, "Dr. Chen, were you scared when you were doing the surgery?" He had paused, considering his answer carefully. "Yes, Emma, I was scared," he admitted. Being scared doesn't mean you can't do what needs to be done. It means you understand how important it is. That exchange led Robert to develop a new philosophy about medical education. He began advocating for training programs that didn't just teach technical skills, but also prepared medical professionals for the psychological challenges of high-stakes emergency medicine. He argued that doctors needed to be comfortable with fear, uncertainty, and improvisation, qualities that were sometimes underemphasized in controlled academic settings. His first major speaking engagement was at the annual conference of the American College of Surgeons. Standing before hundreds of his peers, Robert didn't focus on the dramatic details of the airplane surgery. Instead, he challenged them to think about the essence of their profession. "We've become so dependent on technology that we sometimes forget medicine is ultimately about human judgment, knowledge, and courage," he said. "Every piece of equipment we use is just a tool to help us apply what we know. But the knowing, that's what we can never afford to lose." The speech resonated deeply with many in attendance, particularly older surgeons who remembered practicing in less technologically advanced times. But it also sparked important conversations among younger physicians about balancing modern capabilities with fundamental skills. Robert also became involved with airline safety organizations, helping to redesign emergency medical kits carried on commercial flights. While he acknowledged that his situation had been extraordinary and wouldn't often be repeated, He argued for better-equipped kits that could handle a wider range of emergencies. His recommendations led to significant improvements in what airlines were required to carry, potentially saving lives in future in-flight medical crises. Perhaps most importantly, Robert found new meaning in his life after years of drifting following Margaret's death. The experience on Flight 447 reminded him that his skills and knowledge still had value, that he still had contributions to make. Margaret would have been proud, he thought, not just of the surgery itself, but of how he had found his way back to purpose and engagement with the world. As he settled into his new role as a consultant and educator, Robert Chen understood that Flight 447 had given him more than just a dramatic story to tell. It had given him a second act in his medical career, an opportunity to influence the next generation of healthcare providers, and a renewed appreciation for the sacred trust that exists between doctors and patients. The improvised surgery at 37,000 feet had saved Emma Thompson's life, but in many ways, it had also saved his own.